In 2011, the World Health Organization reported 240,000 leprosy cases worldwide, with the highest prevalence in India and Brazil. In the Western Pacific, the Philippines reports over 2,000 cases annually, followed by China with the highest prevalence. Centers for Disease Control and Prevention Bacterial Special Pathogens Branch medical epidemiologist Dr. David Blaney says although a small percentage is affected, the biblically famous disease exists on our island too.
It does exist here on Guam. They see between 8 and 10 cases per year, and the patients are treated here in the public health, through public health. It's a very difficult disease to catch. It takes prolonged close contact, and most people are genetically not susceptible to becoming infected in the first place.
Last week, close to 40 nurses and doctors participated in a workshop on leprosy, where they learned to perform skin examinations, to recognize rashes, and how to perform neurological assessments for sensory loss or motor weakness. Accompanying Dr. Blaney is veterinarian Dr. Tom Doker, who explains trademark symptoms of the skin disease.
Starts out as a one or multiple skin rashes, just areas marked out on your skin. And one of the trademark signs of leprosy is that you have no feeling inside those where the rashes are. So you can almost make a clinical diagnosis just from finding that. And they also, there are lesions that show up and the patient, it doesn't bother the patient. They don't feel sick. And it may be years before they go to the doctor. And the doctor asks them and says, how long has it been there? Well, it's been there a year or two, but it hasn't caused a problem.
Unlike other rashes, leprosy doesn't respond to commonly prescribed rash creams.
The thing with leprosy, the skin lesions will not respond to antifungals or steroid creams. It'll still remain or continue to grow in size. So that would be another indication that the rash that's not responding to your standard treatments could be leprosy.
If left untreated, leprosy could result in permanent nerve damage.
Treatment, the medication is free for treatment, and it's important because the disease can progress to cause permanent nerve damage that can then lead to disabilities, even paralysis. So it's important to get treated early for the disease before you have any permanent damage.
Health Check is presented by Island Cancer Center.